A couple of videos today. We do have a couple of videos today. So to ensure the best quality video, I'm asking if you're not a speaker to please not only mute your phone, but please turn off your video. Sorry about that. I just want to ensure that everyone has I love seeing all your smiley faces. However, this way it really does ensure that we're able to make sure we have the best quality video. So if you could please turn off your video if you are not a speaker. Thank you so much. So we're about to kick off here and we're going to get going. My name is Julia Osterman. I'm the Chief of Communications and Public Affairs at Bluewater Health. And we have a rather exciting announcement for you here today. I would like very much to welcome our guest speakers. We will start with MPP Bob Bailey. We will then have a recorded announcement by Premier Doug Ford, a recorded announcement by the Minister of Health, Christine Elliott. CEO and President of Bluewater Health, Michael Bain, will be joining us, Vice President Paula Rayom Zimmer, after which point we will open the call to questions specifically from the media. This is predominantly a media conference, and we have Lori Hicks, who's a patient advocate, a family member with lived experience. She's also available to answer media questions. So not only will you have media questions available to the three individuals here with us in person today, but also Ms. Hicks. So thank you so much, everyone, for joining us. Again, I appreciate you muting your phones or your devices, and indeed turning off your camera if you're not speaking. Thank you so much, Mr. Bailey.
Well, thank you, Julia, and good morning to Bluewater Health and Sarnia Lambton. What a beautiful day out there today. And thank you for that kind introduction, Julia. I'd like to welcome everyone who's joining us today via Zoom. I want to start by saying thank you to all the members of the Bluewater Health family that are both with us today and they're at home or back at the hospital working in either Petrolia or the Bluewater Health campus in Sarnia. I know how difficult the last 2 years have been on everyone. The team at Bluewater Health has shown tremendous leadership and courage in responding to the constantly changing demands of this pandemic. All of us in Lambton County appreciate the heroic effort and tremendous sacrifices you have made in our behalf. On behalf of Sarnia Lambton and the province, I want to say thank you. I believe that today's news is a great example of how our provincial government is helping to support Bluewater Health and their many other community partners in the outstanding work you all do in serving this great community. Recently, I was quoted in the media as saying that a very important announcement on the permanent withdrawal management facility was, in other words, imminent. Well, this morning, I am thrilled to announce that the day that we have all been waiting for has finally arrived. It's my great pleasure to share with you today that the Ministry of Health and this Ontario government have approved Bluewater Health for a one-time capital implementation grant of up to $12,231,000 for the permanent Bluewater Health Community Addictions Hub. After years of hard work by so many in our community, I'm thrilled for everyone who has played a part in advocating so strongly for this project. Thank you to all the members of the community who wrote letters and emails, signed petitions, made phone calls, and worked relentlessly to make this idea become a reality. As you all know, our community has been dealing with an addictions crisis for many years. The added pressures of this pandemic have only increased the need for critically important mental health and addiction services. That is why I am so proud that we have been able to secure this commitment from the Ontario government and that we can now move to the next stages of development for this important facility. I want to congratulate Bluewater Health President and CEO Mike Lapine, Vice President of Integrated Services Paula Rayom Zimmer, and everyone in our community who has helped in getting this proposal to this stage. And I also want to thank personally Lori Hicks for being such a strong advocate in our community. First to secure the current 7-bed facility at Bluewater Health, and then in helping us to secure funding to open Ryan's house. And now, finally, the next stages of this permanent facility. Thank you, Lori, for all the work you and your loved ones have done in this community. I will now pass things back to Julia to share a couple of messages from Queen's Park. And thank you again, everyone.
Thank you so much, Bob. What an exciting day. We will now hear 2 videos.
I can't hear that.
One second, we'll try and fix the audio on that.
My friends, today is a great day for the people of Sarnia-Lambton. Our government made a promise at the very beginning to end hallway healthcare across Ontario. Since then, we've do investments to ensure that everyone, regardless of where you live in the province, has access to high quality healthcare close to home. Mental health is health, and I believe that the people dealing with mental health and addictions challenges deserve access to treatment and care they need. I know this has been a huge issue for the community for many years, and the pandemic has only made it worse. You've waited for far too long because the last provincial Liberal government forgot about you and ignored the rest of rural Ontario. After years of neglect from the previous government, I am proud that we are delivering on a promise that I made to build a new mental health and addictions community hub that meets your needs. The hub will include the 24-bed withdrawal management program that your community has long asked for. And we're going to make sure that it gets built with the $12 million investment announced today. Promises made, promises kept. This critical investment will provide much needed hope and support to people on their journey to wellness, as well help build stronger, healthier, and safer communities. Thanks to everyone involved in making this happen. It was a real community effort, but I want to give a big shout out to my all-star MVP, Bob Bailey. He's done an incredible job advocating for your community and championing such an important project that will make a tremendous impact on many lives. Thank you. God bless the people of Sarnia-Lambton.
Hello, everyone. To begin, I want to thank the healthcare workers, staff, and leadership team at Bluewater Health for your efforts to provide exceptional care to patients throughout the COVID-19 pandemic. From administering COVID-19 vaccines to launching a special response team to ensure people in the community have the support they need, you have risen to every challenge with creativity and determination. We cannot thank you enough for going above and beyond to keep your community healthy and safe. Long before any of us had heard of COVID-19, our government made a commitment to end hallway healthcare and build a better, connected healthcare system centered on the needs of patients. This includes ensuring that all Ontarians have access to high-quality mental health and addiction supports and services. Today, we are delivering on that commitment with a $12 million investment to help Bluewater Health build a new mental health and addictions community hub. For far too long, your community has asked for a modern facility and more beds to care for patients facing mental health and addiction challenges. Once completed, the new community hub will have a 24-bed withdrawal management program that will ensure patients receive the care they need closer to home. Congratulations, Bluewater Health, and all the community partners who have come together in support of this new community hub. And I do want to extend a special thank you to MPP Bailey for his dedication to supporting your community and championing this important project. Together, we will ensure that all Ontarians are supported on their journey to mental wellness and end hallway healthcare in Sarnia-Lambton. Thank you.
Okay, good morning, everyone. I'm Michael Bain, President and CEO of Bluewater Health. This is a great day for celebration, and what I'd like to do is just provide a little bit of context and background around this project. So our community has been experiencing an addiction crisis for several years now, and it's been actually exacerbated by the last 2 years of COVID. We have in Sarnia-Lambton, we have a high-risk population and with not enough addiction services locally. We see a significant number of drug-related arrests, higher rates of housing vulnerability, a high usage of crystal meth and prescription opioids, and a strong culture of drinking and marijuana use. At Bluewater Health, actually, we've seen about a 20% demand in our withdrawal management services over the last 4 years. So about a dozen years ago, we embarked on this journey to get a full-service 24-bed facility here for withdrawal management treatment facility, which was both acute and stabilization beds. In 2015, we submitted a pre-capital submission for $8.5 million to operate a 24-bed withdrawal management facility. And although the initial ask was $8.5 million, the Ministry of Health has confirmed $12.2 million as an updated allowance. And then along this journey, 4 years ago, we opened our first 7 withdrawal management beds within the hospital. And in that time, we've actually cared for more than 1,100 individuals. And that represents almost about 8,000 patient days. So just those 7 beds have made a huge impact. But further to that, 1 year ago, we actually opened a new temporary 12-bed phase 2 withdrawal management stabilization transitional facility, commonly known as Ryan's House. And since its opening, we've served over 100 clients and over 3,000 patient days. So both of these services are really needed, and we make great use of them. But the most important message today, I think, is around how much community partnership has been involved in getting us to this point today. It wouldn't have been possible without our community and health partners. And this means from working to provide better addiction services for our community to our Addictions Center Planning Steering Committee. Our community partners have supported and advocated for us every step of the way. And this today is just a culmination of all those efforts. It's really a community celebration. Our local elected officials have advocated for this project at the provincial level. We've had advocacy groups signing petitions. We've heard the community's cry for help. So today we're so grateful for this commitment from the province and to look forward to the next steps in completing our community addictions hub to support our community's growing needs. So today I think is a great step forward in really changing lives for the better in Lambton County. So thank you so much to both the province and particularly MPP Bob Bailey for all he's done. I'd like to pass this over to Paul Rayom Zimmer now, just to give us a little bit of background around both the location and the model of care that will be used in this facility. So Paula.
Thanks, Mike. So I'm very proud and very excited to join you today for this message. And I'm very proud of the work that our addictions and mental health team have accomplished. As Mike said, our steering committee and community partners have worked closely to develop our best practice model in addictions care and in keeping with the Ontario standards for withdrawal management. So the Bluewater Health Community Addictions Hub, it will include the 24-bed facility. It'll have, and we've referenced this so many times in the past, and it's just so exciting to finally be at this point. It will include the 8 observation beds. That's the initial acute withdrawal phase, 10 withdrawal management beds, 6 stabilization beds that will help bridge either to back to outpatient care or often to a regional treatment rehabilitative program. The hub will also include all of Bluewater Health Addictions outpatient services. That includes our community withdrawal management services, our addictions therapy, primary health care for addictions, for individuals with substance use disorders. It will also have clinical space for program treatment and consultation with community mental health and addictions partners. and with our community partners such as housing, another critical element to a successful recovery plan. So I do just want to take a moment to clarify, there is a misunderstanding in the community about the Addictions Hub and the 24 beds compared to a rehab rehabilitative center like Westover or Brentwood. So these beds are still, they are targeted to respond to the early stages of recovery, and we'll still be working closely with our regional partners to support longer term treatment that's required. And certainly this is all a system planning, and a rehab program in Sarnia-Lambton would be an ideal future state to focus on. But right now we know that the demand is for the withdrawal management stage. Through our experience in the 7 intern beds at Bluewater Health, the demand is very high. On a daily basis, we often turn down 6 to 12 requests for a bed each day. And sometimes that includes someone calling several times, but it still demonstrates the desperation for access to the bed. And so expanding the number of beds and creating a permanent facility that really allows us to improve the space, the synergy amongst partners, and the kind of ease of access is very important for us. So individuals, also what we have learned through, it's been a bit of a blessing that we've had opportunity to have interim models, because they have been great opportunities to learn from our leadership and our frontline staff. Individuals right now accessing withdrawal management services often arrive with coexisting medical conditions. Sometimes we've required emergency responses. In addition, several patients who have been cleared from our emerge department have been redirected to withdrawal management beds. And this has improved the care for individuals requiring withdrawal management and has allowed for diversion from the emerge department. The Community Addictions Hub will offer a calm and welcoming environment that inspires a therapeutic setting of hope and healing. So we have worked very closely in 2018. Actually, we undertook a very extensive site location exercise and worked with a consultant and we will be announcing, and today are able to announce that the site will be the space that extends along Russell Street and London Road, adjacent to Bluewater Health Russell Street building. So this will be, this building, it's been vacant since 2011, and in final completion, it will have a separate and distinct entrance with wraparound services aimed for care for individuals with substance use disorder and coexisting mental health needs. We've awaited confirmation at stage 2, and the lessons learned really have allowed us to put further consideration on our planning, and we think that this will really allow for an ideal structure and model when we're able to open our doors. In the last 4 years, it has served us well to have this resource in close proximity to the emerge department, and we've been able to share resources amongst programs when patient care demands are high, when there's concerns for safety. So we're also feel that this the interim space has validated the decision on where we are going to be opening. We are confident architecturally that we'll create the space, the serene space that is conducive to recovering while leveraging our infrastructure at the hospital. So it's definitely an exciting time for all of us, and we are thrilled of the ministry's commitment and the approval to allow Bluewater Health and all of our community partners who have been involved in this exercise into the exciting phase of the project planning, tendering, and design. And this is where the fun begins, and it's so much more of a reality for all of us. So thank you so much for all of the folks who have supported this, and we're extremely grateful. And it's hard to believe we're finally having this conversation. So
Thank you so much, Paula. I know there have been lots of shouts of joy and high fives and tears over this. So it's truly thrilling information. Thank you so much. That is the press conference. I have opportunity now. We have some time for media questions. Again, the questions are for media. If you have anyone from the community, if you have a question, you want to email it to communications@bluewaterhealth.ca. We'll be happy to get back to you at at a later date, but for the sake of expediency, we're going to ask that media please raise their hand. I have several screens here, so I'll try and find you. If you have a question for Lori, Paula, Bob, or Mike, please let me know.